I know that the public has heard a lot of messages about the problem of antibiotic resistance. We've been seeing a lot in the media about superbugs, about the potential for having infections that are not able to be treated. And we need to continue to get those messages out there because obviously that's one of our biggest concerns, that we will not have the tools we need to treat infections. However, what I think is really important is that when someone is thinking about, oh, well, I think I might have a cold and I need to go to the doctor and I'm interested in seeing if an antibiotic would work for this infection. I think the most important thing to realize at that stage is if you don't have a serious infection or a bacterial infection that requires an antibiotic, antibiotics can actually do more harm than good. And I think for a long time there's been a perception that antibiotics are harmless, that we can take them just like we do like a multivitamin and it'll make us better. And we need to be really cognizant or really understand that antibiotics have the potential not only to lead to adverse events like the rashes and the diarrheas, but the more serious things that I really am much more concerned about that are happening more frequently in the community. For example, Clostridium difficile infections, which we've talked about as a potentially deadly diarrhea. And we're seeing the rate of these infections increase over time, and we're really concerned that if we don't really get the message out there that there's a potential downside to antibiotics, that there will continue to be this patient demand that drives unnecessary antibiotic use.